Now we are going to talk about infection control practice. The infection control practice can be categorized into two major groups: the standard precautions and the transmission-based precautions. First, we are going to talk about the standard precautions. They are the minimum effective preventive infectious strategies that can apply to all patient care, either the patient has a susceptible or confirmed infection. This can be used by the healthcare personnel to prevent infection transmission to themselves and to the patient they are taking care of. They can include several aspects, beginning from hand hygiene to the use of safety equipments to the safe handling of syringes to the drug or medication storage and preparation, also the respiratory hygiene and cough etiquette, and finally the safe handling of the patient secretions or contaminants or tools. First, hand hygiene. Hand hygiene is a very critical step in standard precautions preventing infection. As we can see in this diagram, it is a microorganism in sector A from a hand that is not washed, sector B from hands that is just washed by soap and water. Finally, C, there is no organisms because they are washed with a CDC, which is the alcohol-based wraps or fluids that can protect from transmission of infection. So, when can we do hand hygiene? First of all, hand hygiene is very simple but very critical. It should be done in every situation in contact with the patient. It should be done, as we can see, before touching the patient, before beginning of aseptic procedures as central line insertion. It should be done after and before using or evacuating patient's environment. It should be done after examining the patient and leaving the patient, and after touching the patient's surrounding. The second topic in standard precautions is the personal protective equipments, or what's so called PPE. They are set of equipments that can protect the healthcare providers from transmitting infection. They include gloves, they include goggles, or even face shields. They can include the aprons or gowns used by surgeons. They include the shoe caps and also the head caps. Gloves. Gloves are the first of the personal protective equipments. Of the many types of gloves, they are used to protect the healthcare providers and the patient from transmission of infection when handling the mucous membranes, the skin, the infection in the surgical site, and the body fluids or excretions. Gloves should be task specific and should be single use only. Gloves should be worn after hand wash. Masks. Masks are very important to protect the mouth, the nose, from transmitting infection. They should be used before and after the contaminated patient or contaminated secretions from mucous membrane, from coughing, sneezing, and etc. They are also single use and they cannot be used again. The protective eyeglasses or face shields, they are very important when dealing with a patient who you suspect there will be splashes of blood or mucous membrane or mucous plugs contamination. They also can be used for single use only or can be washed for another use. Wearing gowns or aprons. They are specific for the procedures which can contain contamination by splashes of blood, droplets from the patient respiratory tract, or even dealing with the contaminated environment of the patient. They are usually used in the OR or in the operating room. The aprons are single use. They shouldn't be used again and shouldn't be used if wet or disposed. Caps and foot covers. They are very important to protect the patient from the infections which can be transmitted by the hair and the dirt in the shoes. The next topic is prevention of needle sticks and sharps injuries. Needles, scalpels, and any sharp objects within the hospital should be dealt with caution. You should use disposable syringes, one time use for one patient. You shouldn't reuse them again ever. You should never leave them to someone else to clean up or put in the disposal box. The box of the sharps or the needles should be filled only 34% and should be disposed. Finally, you shouldn't recap a syringe. You shouldn't use them again. Medication storage and handling. Medication preparation and storage is very important. You should use single-use vials, and you should use multiple-dose vials with caution. During medication storage, it should be applied by the manufacturer. Guidelines by manufacturer should be restricted. The drugs are used in a specific room. They are stored in a fridge or freezer, and they shouldn't be exposed to the light or any dirt surroundings. During drug preparation, it should be done by specific personnel under aseptic conditions and should be administered to the patient immediately. So when we can discard a drug? According to the manufacturer guidelines, a single-use vial should be discarded after its use to the patient. Never put it or use it again. A multi-dose vial should be used within a period of 28 days. Nevertheless, if the manufacturer guidelines applied for less or more days. Next in standard precaution are the respiratory hygiene and cough etiquette. During coughing, sneezing, etc., we should cover the mouth and hands. We should use tissues for the respiratory secretions, and we should wash our hands before and after. Patient care equipments. The equipments should be used in patient care are simple, non-reusable equipments. And if we use reusable equipments, it should be cleaned and aseptic. Second are waste disposal. Wastes are a very important source of infection in hospital. It should be treated with caution, should be disposed according to the local regulations, and the specimen taken from that waste should be under very meticulous techniques and should be discarded afterwards.